Good morning, students. Today we are going to learn about Introduction to Health Assessment. Health assessment is one of the most important responsibilities of a nurse before giving care to the patient. A nurse must first collect information about the patient's physical, mental, social, and emotional condition. This process is called assessment. So, proper assessment helps nurses identify patient problems, plan care, and improve recovery. In this session, we will learn the meaning, purpose, types, and components of health assessment. According to the World Health Organization, health is not simply the absence of disease. A person is considered healthy only when there is a complete physical, mental, social, and spiritual well being. Physical health means proper functioning of the body, whereas mental health means emotional balance and ability to cope up with stress. Social health refers to maintaining good relationship with others. Spiritual health relates to inner peace, values, and beliefs. As nurses, we should assess all these dimensions while giving care for the patients. Assessment means systemic collection of information about a patient's health status. It is the first step in the nursing process. Nurses collect information by interviewing the patient, observing the signs and symptoms, and performing physical examination. Assessment helps identify actual and potential health problems. So, without proper assessment, nurses cannot provide effective patient care. Therefore, assessment forms the foundation for nursing diagnosis and treatment planning. So next we move on to the health assessment. So here the health assessment is an organized and continuous process for evaluating a patient's health condition. It includes physical examination, psychological assessment, and social evaluation. Nurses perform assessment from the time of admission until discharge. The purpose is to gather accurate information regarding the patient's conditions. So, health assessment helps to identify disease earlier, understand the patient needs, can able to monitor her progress and evaluate treatment effectiveness. So, continuous assessment ensures quality patient care. So next we move on to the purpose of health assessment. Here the main purpose of health assessment is to collect complete information about the patient. It also helps nurses to identify health problems and determine patient needs. Assessment is also useful for preparing nursing care plans and monitoring changes in the patient's conditions. Through regular assessment, nurses can prevent complications and provide timely treatment. Accurate assessment helps to improve patient safety and overall health outcomes. Then, the characteristics of good assessment. A good assessment should be a systematic, meaning it must follow an organized method. It should be accurate because inaccurate information may lead to wrong treatment. So, assessment must be a holistic one. It covers physical, mental, social, and spiritual aspects. It should be a patient centered, focusing on the patient's individual needs. Assessment is a continuous because patient's conditions may change over time. Finally, all patient information should remain confidential and protected. So, it will be a systemic, accurate, holistic, patient centered, continuous, and confidential one. So next we move on to the types of health assessment. Here there are different types of health assessment used in nursing practice. Initial assessment is performed during the first contact with the patient. Focused assessment concentrates on a specific problem such as if the patient is having a pain or breathing difficulties, etc. If the emergency assessment is done quickly during emergency situations to save the life. So ongoing assessment. Ongoing assessment is a continuous monitoring of patient progress. And then comprehensive assessment. Comprehensive assessment is a detailed examination of patient's overall health conditions. So nurses Choose the type of assessment based on the patient's needs. So next one is the components. So health assessment has four important components. The first is the health history, where nurses collect information about present illness, past illness, family history, and lifestyle habits. The second is the physical examination, which includes inspection, palpation, percussion, and auscultation. The third is the observation, where nurses observe the patient appearance, behavioral, and emotional conditions. And fourth is the documentation, which means recording all assessment findings accurately for future reference and continuity of care. So next one is the sources of data. So assessment data can come from different sources. The primary source of information is the patient because the patient can directly describe symptoms and feelings. Secondary sources include family members, medical records, laboratory reports, and other health professionals. Whereas secondary sources are especially important when the patient is unconscious, confused, or unable to communicate properly. So, nurses should collect reliable information from all available sources for accurate assessment. So, we have the two data here. The assessment data are divided into two. One is the subjective data, another one is the objective data. So, subjective data are symptoms experienced and described by the patient. So these cannot be directly measured. Examples like pain, nausea, weakness, and dizziness. Whereas objective data are measurable and observable findings collected by the nurse. Examples includes temperature, pulse rate, blood pressure, and laboratory reports. So both types of data are equally important for identifying the patient problems and planning nursing care. Then importance of communication. So communication is an essential skill in health assessment. So good communication helps to build trust between nurse and the patient. Patient feels comfortable in sharing information when the nurses communicate politely and respectfully. Effective communication also improves patient cooperation during examination and treatment. So, through communication, nurses can identify emotional needs, fears, and concerns of the patient. Therefore, nurses should practice active listening, empathy, and clear communication skills. Finally, to conclude, in conclusion, health assessment is the foundation of nursing care. Accurate assessment helps nurses to identify the problems and plan treatment and improve patient outcomes. Effective communication and careful observation are essential during assessment. Nurses should perform assessment systematically and continuously to provide quality patient centered care. Understanding the health assessment is very important for every nursing student because it is the first step towards safe and effective nursing practice. Thank you.